My name is Ari Cedars, and I am an associate professor of medicine and pediatrics at Johns Hopkins. I'm the head of the adult congenital heart disease program here. I actually have a few research topics, and you could say I'm kind of intellectually promiscuous, I guess. So one of my research interests is in heart failure in adults with congenital heart disease and how adults with congenital heart disease fare after transplant or implant of mechanical circulatory support. One is in deep phenotyping of Fontan patients in particular and seeing the ways that the metabolite profile in patients with a Fontan circulation may interact with their clinical status in impacting their overall care. And finally, I have an interest in patient-centered research. Specifically, I designed an outcome to objectively assess how patients are doing clinically in between visits, with hopes that that may help me provide better care to my patients in a way that's really focused on the things that are most important to them, like their life at home. Well, I think the motivation for all of our research should be to improve patients' lives. Not just the amount of life, but the quality of the life that they have. Most of the patients I see have chronic heart disease, and I want to help them live the fullest life possible. So my goal is to improve the lives of the patients I care for. The majority of the research that I'm engaged in is based on interactions I've had with patients, things that they have mentioned to me, or things that they have experienced which have been impactful for me, so that I can hopefully help future patients avoid the same consequences of their disease process. Well, I believe the Heart Center is focused on improving the quality and quantity of life of children born with congenital heart disease. And my research is really on helping those who were born with congenital heart disease and who may have had surgery during childhood live more full lives as adults, because congenital heart disease doesn't go away when you become 18. There's a full life ahead of you thereafter, and it's my job to make sure that life is as full and meaningful as possible.